Hi guys, thank you guys for being here. Dr. Dylan Greeney, board certified dermatologist. I'm always here to help you get your best skin. I love telling you guys effective and affordable skincare to help get your best skin, things that are easy for you to access. So if you have any questions, just drop them in the chat. We're just starting the live. You're here at the right time. Make sure to invite a friend. If you got a friend that loves skincare, now's the time to invite them. Want to hop on and chat with you guys for a little bit. I hope you guys are having a wonderful Sunday. Again, I'm Dr. Dylan Greeney. I'm okay. I'm not sweating. I just finished my skincare routine. So right now in the skin, I have Brandify Vitamin C Serum, which I think is one of the most important things that you can do. Brandify Vitamin C Serum. Vitamin C serves as an antioxidant, obviously. It supports our collagen. It helps to form collagen. And I also have the Peter Thomas Roth Water Drenched Tinted Sunscreen on my face. That's all I have on my face right now. I usually actually use Drunk Elephant Marula oil, but I actually forgot because I was thinking about getting up here with you guys. So I don't have that on my skin right now. But those are some of my favorite tips. I think everybody should be using a vitamin C serum in the morning. You should always use a great sunscreen. If you guys didn't know, 80% of your aging of your skin is from UV exposure. So the people out here saying, hey, like, get the sun, lay in the sun, whatever it might be, don't trust that advice. It's the worst advice you can do. So yeah, for the people that are on Accutane, definitely should not be drinking when you're on Accutane. Accutane, fortunately, is one of the best treatments that there is for acne. It's the only thing that can cure acne permanently. Yeah, do not ever lay in the sun. I totally agree. Fragrances, your neck and your eyelids are going to be much more sensitive skin. So you got to be careful with that. The eyelids are probably the most sensitive skin on the body. The neck is probably the second most. So I see a lot of eye dermatitis and neck dermatitis from fragrances. So just be a little careful with that. Now, there's plenty of us that have no trouble with fragrance. Like I don't really. Now, in dermatology, when I rate skincare products, if they have fragrance, it kind of deducts points. If they have fragrance and it smells bad, that really deducts points. But so bland and boring is the way generally. But fragrance sometimes can break out your neck and face. So Briggs family says, your thoughts on Retin-A. So when we talked about a great skincare routine, we're talking about the vitamin C sunscreen and a retinol or retinoid. So Retin-A is a brand name of a retinoid. And you guys have probably heard about a lot of that. I know a lot of you guys on here love skincare. So thanks for being here. But Retin-A or retinoids are the best thing you can do for your skin next to sunscreen. And that's because they help so many different things. So if you're using a retinoid on your face, it's going to help with fine lines and wrinkles. It's going to help with dark spots. It's going to help for smoother skin texture. It's going to help to reduce breakouts. So Retin-A is wonderful. The key if you're starting a retinol or retinoid is that you start slow and don't overdo it. You don't want to overdo it. You want to use just a pea-sized amount for your whole face, which doesn't sound like a lot, but just a pea-sized amount for your whole face. Just kind of dot that together and then dot that all over your skin. So, and then you can use a moisturizer after because you're going to get a little dry and irritated in the beginning. So that's the one thing. How to prevent oil buildup throughout the day. So if you got oil buildup during the day, which a lot of people do, if you're more combination or oily skin type, you're going to build that up some. There's a couple different ways. One, use a good foaming facial cleanser. If you're looking for a good foaming facial cleanser, I would get like La Roche-Posay Tolerian foaming facial cleanser or the CeraVe foaming facial cleanser. These are good options. And then you could do other things like use toners that have like kaolin clay in it that maybe absorb some of that oil. So that's another way to kind of help with that. So baby powder is oil absorbent. I don't know how that works in the face. I don't know if I'd recommend that. I don't know if it's good to breathe. Seth, thank you so much for the roses. I appreciate it. And also La Marina, thank you for the fest burst. I appreciate it. You're awesome. So thank you. Thank you. Skin turns purple. So there are a lot of people that can get conditions like livedo reticularis or Raynaud's when their skin is cold, or you have these like vascular phenomenon when you get hot or cold, your skin can look a little funny. So one of the more common things I see with people is they're like, oh, I get in the shower and I'm super red or whatever. You got to realize like all of us are very sensitive. Like when you rub your skin and put on your skincare, sometimes you look red for a little bit. When you get in the shower and you feel that heat, sometimes you get red for a little bit. If it's not persisting for 30, minutes, beyond 30 minutes or whatever, you're in good shape. But if it's this little transient thing, like I tend not to worry about it. Sometimes you get a little worked up. Kim asked, is it worth it to become a dermatologist? I absolutely think it was. I can't imagine myself being any other kind of doctor. I love dermatology. It was great being in the OR, but the cool thing about derm is, you get to do skin surgery. And I get to do all kinds of very cool laser procedures. So for those of you guys, I do about 50% cosmetic dermatology. I do 50% medical dermatology and surgery. So I kind of get scratch the itch of all these things, which is great. Best moisturizer on Accutane, I would go with a CeraVe moisturizing cream in the jar for the face and stuff. If you're looking for something slightly thicker and richer for the body, I would go with the La Roche-Posay Triple Repair Moisturizer. I think those are really, really good options. Brookish Batty, I think it is, CC. Thank you for the heart puff. And Aaron Johnson, thanks for the good games. I appreciate you. Thank you. Thank you. Do you have a recommended good vitamin C serum you recommend for AM or PM? So ideally, you can use vitamin C serums morning and night. If I'm going to recommend one for you that is the best vitamin C that you can get, is I would absolutely get Brandify vitamin C. I do not make money from this, but I do help that company formulate their skincare products. If you use the code Greeney40, you literally get it 40% off. That's basically at cost. So it's something I negotiated with the brand for you guys and for my patients. So brandifyskin.com, Greeney40, 40% off, and it's the best vitamin C you can get. If you're more acne prone, they make one that's called the Psyllium. And if you're more like a regular skin type, then you can go with more of that, like that bluish tinted one. So the white label is more acne prone. The blue label is more of the regular skin types. So I think Aaron had a question. I was trying to roll back up to it because Aaron had also sent some roses, I believe. So Maria, good serum for rosacea prone skin. So anything that's hydrating and gentle, you want hydrating and gentle. So things like Aven, those kind of things. Thank you for the hand heart, La Marina. Appreciate it. Allergy related eczema. You got to kind of, eczema is kind of you have more eosinophils and things in your skin with eczema. Those are like allergic kind of cells. So also people have elevated IgE, which is kind of an allergy thing too. So it's not everybody though that has a lot of allergies that's why you get eczema necessarily. But there is a issue with eczema. Your skin barrier is a little bit compromised. So that means that water can get out of your skin easier. Also things in the environment that might potentially irritate your skin, like fragrance or whatever it may be, maybe just like anti-aging stuff like acids, they can kind of penetrate your skin easier and cause more irritation. So in eczema, the base of the whole problem is you want to make sure you're moisturizing your skin and you're keeping your skin barrier strong. That's the most important thing that you can do. So some people are going to have to get on things like Dupixent, which is an injection that can kind of calm down all that inflammation and get your skin happy. So those are some things that can be done for it. Topical steroids are used for it. Now there's there's steroid-free topicals that you can use for eczema too. So there's a lot of different things out there now. It's overall. Someone says they have dyshydrotic eczema. That's kind of like a special kind of eczema on the hands and feet. Austin, I believe, was asking about Morpheus. So you guys have probably heard a lot. Like I said, you have 50% cosmetic dermatology, but Morpheus is a type of radio frequency microneedling. It's a cosmetic procedure that can be done in a lot of different parts of the body at variable depths. And microneedling itself is basically just vibrating needles that go a set amount of depth in the skin to separate skin cells or puncture skin cells to create a small wound to stimulate collagen, right? Now, you can do this even more effectively if you do the microneedling, but radio frequency also adds an element of heat. And sometimes we use heat in lasers, both non-ablative and ablative lasers, to stimulate collagen formation. About it, unfortunately, this is quite painful. So it's quite painful, like many procedures, unless it's the most aggressive procedures, which I do some of, like fully ablative laser resurfacing. If I do a really intense procedure like that, the downtime is very extreme, but the results are great in a single session. With Morpheus, you got to imagine only part of the skin's getting treated that's getting hit with the needles, right? So it's in a way a bit of a fractional. It's a bit of a fractional result. So you have to usually get multiple treatments with these things that are fractionally treated, So overall, it's painful. I've heard some people be disappointed in the results, to be honest with you. But a lot of that is setting expectations. And I think the reality of it is, when it comes to Morpheus, is these are very expensive devices. So they're very, very expensive devices. People get sold them. And then if you're not an ethical person, then what you're doing is you're trying to sell that treatment to every single person, regardless if it's the right treatment for them or not. So if you've ever been my patient, I don't even know, man. There's probably like 5 in 10 people that come in that ask about something, and I say, no, that's not a good idea. Now, realistically, I could sell that to them. I don't do that. And I think that's unfortunately what gets things like Cool Sculpting, Morpheus, some of these things a bad rap, because people are selling them to the wrong people. They're selling them to the people that it's not going to meet their expectations. They're not filling out what their goals are. So that's the deep down on Morpheus. So that is kind of a deep dive on it, but I think it could be good for some people. Maintaining seborrheic dermatitis, I would definitely, there's something actually new that dropped for that. I would definitely look at Vichy Durcos. So it's a new, I dropped it in the chat, but it's a new shampoo that has selenium in it, kind of like Selsun Blue. And you could use that for it, or you could use Nizoral shampoo, aka ketoconazole. These are good options for it too. So those are some good options that you can do for it. So I kind of look into those things. Let's see. Is it true that sunscreens have toxic ingredients? So generally no. What it comes down to is there are some older sunscreen ingredients that, is there some element of it being a hormone disruptor? Well, a lot of those things you can't even really find in sunscreens anymore. Those really aren't even in sunscreens anymore. Something happened about 5 years ago though, where there was a study done, and basically people used sunscreen, I believe, in the way that you're supposed to, which most people don't. Most people don't apply enough. They used it the way they were supposed to. And then we checked their blood levels, and there were more sunscreen ingredients in their blood than we would have expected. Now, the reality is though, we don't know, and there's no evidence to show that that actually causes any problem. So it's like, sure, okay, you maybe find something somewhere, or you know, whatever it may be, and you see levels of this that are elevated. It doesn't necessarily mean it's causing a problem. We don't really have evidence that's causing a problem. Now, if you want to avoid, you know, like all the worry of it, something you can do is you could use sunscreens that are pure mineral sunscreens like zinc and titanium. So those are going to be some really common mineral type sunscreens, zinc and titanium dioxide. And those are really not absorbed to the skin in the same way. And they certainly don't have like this potential hormonal, you know, it avoids the whole controversy of it. Now, there are ones that are very great. Sometimes finding a pure mineral sunscreen is a little bit more challenging than finding a chemical one. So Hassan says, do preteens need skincare? So what I would do, Hassan, the one thing I would do, we've talked a lot about sunscreen and how sun exposure not only can lead to skin cancer down the road, but also it is, you know, it causes about 80% of our skin aging. So preteens need to definitely be doing probably cleansing of their face as a good habit, and also using sunscreens in the morning and if they're going to be outside. So I would look at that. Now, as you start getting closer to teenage years, probably going to switch that cleanser to maybe like a very mild acne cleanser, something like that, because you want to keep that stuff at bay as long as you can. Despite that, 90% of us are going to deal with acne, and it's going to usually, you know, maybe it requires treatment. Aaron, thank you again for the good games. You rock. I appreciate it, Aaron. Thank you. Thank you. So yeah. And then Smart Education says, sir, about minoxidil, I'm getting hair fall genetic issue. So yeah, so a lot of you guys have questions about hair fall. Anna King, thanks for the roses. Appreciate you. So yeah, so you guys ask a ton of hair questions, right? Which is reasonable. It's very, very worrisome. I want to get to the hair question because JT asked a question: does it zinc or mineral sunscreen make you look like Zuck? So you guys remember the Mark Zuckerberg picture when he was like ghostly white on the surfboard, or what? It's not a surfboard. It's I think it was a motorized surfboard thing. That's what I was saying. Sometimes it's a little bit more challenging to find a pure mineral sunscreen. None of them are probably going to be, if you on average, as elegant as the chemical-based sunscreens, right? But you can definitely find ones that are great. So you just got to look, definitely lean into tinted mineral sunscreens. That's going to get you there a whole lot easier. Now let's talk a little bit about the hair fall of minoxidil. So a lot of people are going to lose their hair. Pretty much everyone's hair is going to thin as we age. In the younger years, a lot of that hair loss in women is things like telogen effluvium, like you get a bad illness or you get pregnant and you have a baby. your body goes through a lot of physiologic stress, and then a couple months after that, you shed hair, a lot of your hair. Now, for the vast majority of people, that comes back. It just takes a little bit of time. Now, there's a lot of young women in the United States in particular that are overweight. You guys, maybe don't exercise, and you start to get some metabolic issues like PCOS type stuff. And then that shifts your hormones a little bit. Your testosterone levels are slightly higher, in that. And then in that case, you can start having hair thinning too, which is really, really tough, because if you got those elevated levels of testosterone, the reality is that testosterone causes us to lose hair on our scalp and grow unwanted hair, especially in women, on the lips, on the chin, and things like that. So you have to be very careful with those things. You want to make sure you're staying active. You want to make sure you're eating a healthy diet, because those are some of the reasons people get very, very upset about their hair loss. And you got to be doing everything. Now, it's not perfect. Some people are going to get PCOS and they live a healthy lifestyle, right? So, but I'm just saying, there's a lot of people that could avoid it with healthy diet and exercise and staying under control. Now, as time goes on and we end up getting older, our hair is going to thin, and it's always easier to keep it than to regrow it. So things like minoxidil over the counter, which is Rogaine, then you could apply that on the scalp. A lot of women will use it once a day. Guys use it twice a day. And that basically it's almost like fertilizer for the hair. It's going to increase blood flow to your scalp. It's going to nourish those follicles. It's also going to kind of shift your hair into an actively growing phase. Now, if you choose to use that, then you might shed hair a little bit up front for a few weeks. And then over 3 to 4 months, you start getting more baby hairs and flyaways that end up growing into full healthy hairs. So it allows you to protect your hair more. So orange peel skin condition. So I don't know exactly what that means. I don't know if that's texture. There's actually there's like a condition in dermatology. It's like peau d'orange, which is like you're basically the skin looks almost like an orange peel. That can be seen in a variety of things. Like it can be an actually bad sign for things, like if it's on the breast and stuff like that. But if you're talking about just regular skin texture, best ways to help that are going to be using things like retinoids, using potentially like mild exfoliating acids like alpha hydroxy acids and things like that. So if you guys are here and this is helping you, one, I would encourage you strongly to tap the subscribe or tap the follow. I would really encourage you to do that. I want to be here for you guys. I want you guys to see this, this good skincare content. And I want you to, I do great skincare videos to help you guys get your best skin. I think you'd also be more likely to be notified when I do go live. So tap the follow if you guys don't already. And I see those rolling in. I take the magnesium, bro. Am I twitching? I actually take magnesium for sleep. I take a couple different types of magnesium. So, yeah, bro, but thank you. My skin is thin now that I'm 64. So Cher says, skin's thin. With time, your skin will thin out. It loses a lot of collagen and elastin. Part of that is chronologic aging of time, but another big part of that is really going to be damage from the sun. So I see this most commonly. I had a video recently that went viral, looking at a gentleman's like arms and legs, and he's a farmer. So it was looking at his arms and legs and looking at the damage on his arms and legs compared to his his forearm to his upper arm, or his forearm to his leg. And literally you could show this guy's leg to somebody and say, is this a baby skin or is this a 90-year-old man's skin? And you wouldn't know, because it's so perfect. And his arm is absolutely wrecked, dude. So that sun exposure is so key. Now there's ways you can rehab it with things like lasers. You can do lasers on the arms. You can use good retinol body lotions on the arms. And there's a couple different kinds that came out this year. So Gold Bond made a retinol body lotion, which is key. Or you could use Versed retinol body lotion. So these are both good options for that skin quality on the arms, but you got to use it for a long time. Jay Anthony's asking about melasma. Melasma is something that definitely a lot of the women out here have struggled with during pregnancy or while you're on birth control. So with melasma, it's a type of hyperpigmentation. It's dark spots. Sometimes it almost looks like a mustache. So they sometimes call it the mask of pregnancy. Sharky Thanks for your persistence on the SwoleMD question. I personally have not tried that, so I can't really comment on it. I don't really know much about that. Most skincare products I have tried, and I actually am not 100% sure about that SwoleMD. Different overall, I Love Summertime is a great product. It's the best product that you can get over the counter for acne. You could get Different, or you could get La Roche-Posay adapalene, but adapalene is what Different is, and that is one of the best products you can do for acne overall. And then warts occur because of it's actually a viral infection of the skin. It's HPV. So some warts are completely harmless, and some can be, when you hear about HPV, when you think about cervical cancers and those things like that. Ella Mead, hello. Thank you for being here. How to stop triamcinolone when you pull your eyelashes and eyebrows out? How to stop? Oh, trichotillomania. Sorry. Someone else was asking about triamcinolone earlier. So my best advice is there's something called trichotillomania. Trichotillomania. So trichotillomania is basically it's like hair pulling. It's like almost like an obsessive compulsive disorder where you pull, like maybe it's just you're nervous and you pull your eyelashes or you pull your hair, and people will make literal bald spots or they'll pull their whole eyelashes out. So the fact that you acknowledge that you're doing it is a huge thing. Knowing that you're doing it is key. Believe it or not, I have people to come to the clinic and they deny it. They said, I'm not pulling my hair out, and it's like, well, we can know that. We know if you're pulling your hair out or not. So knowing you're doing it is a key for sure. So now some people get on medications for that. Some people maybe could go to almost like a counseling type thing. But one of the biggest tips that I've done is, so Sandra's on meds. So there you go. And I don't know, Sandra, if it's helped you, but it'd be interesting to hear. One of the things that I find that helps people is actually if you put a little bit of Vaseline on the hair that you tend to pull. Sandra here in the chat says it saved her. So that's like a great point, right? But if you put some Vaseline on the hair you tend to pull, we don't like the sticky, oily stuff on our fingers. Okay, that's just something that I think as humans we don't like it. So if that is kind of gooped up and you touch it, now you're greasy. Now you're worried about getting the grease on papers, you're grease on your phone screen. That's a good way to break the habit. You could also replace the habit with something that's a little bit safer and a little bit more, not as harmful to you, right? So you could do things like get a worry stone. And it sounds super cheesy, but I've helped a lot of people with this that pick their nails or pull their hair and stuff. But you could get a worry stone. And the second you go to touch this, maybe you've got the Vaseline on it. You notice you're picking. You notice you're pulling your hair. Okay, I'm picking my hair. I'm pulling my hair. Okay, now get your worry stone out. Rub it. Okay, do that for a few weeks. And a lot of times you can break the habit completely. Now there's times you relapse. You go back to it. But that worry stone has helped so many people. Someone else in the chat says, Diana, she's a psych, and she says CBT for trichotillomania is super helpful. So exactly. So like I said, the therapy, that's another option. Now we've got people in the chat that said they've done some meds. You got people in here that's done some CBT, which is type of therapy, cognitive behavioral therapy. So those are all really good. Now, the reality that we all face is sometimes when people have some of these conditions, there's maybe a stigma about going to see psych or going for some CBT. And, but the fact that you're asking the question, you're like, how can I make this better? Then you're probably more likely to say, hey, I'll do whatever it takes to, to get it better. Right. So that's a great question. I think it gets into something interesting, and it was cool to see not only a psych in the chat, but also other patients with trichotillomania that literally said the treatment helped save them. So let's see. Hair removal laser treatment burnt Polivy, and tell me how to fix it. So here's one thing I'll say is, I'm a dermatologist. I went to school, by the way, XD for 12 years, just for my dermatology training. I actually was a nurse before I was a dermatologist, so that made that process even longer. But here's what I'll tell you. If you guys are going for treatments, you want to go to somebody who's qualified, first of all. So I really recommend going to someplace that is a board certified dermatologist or a plastic surgeon. The level of training that these people get is a lot. Now, I'm very rare. I'm very, very rare because if you come to see me, I do all the treatments. I do those for you myself. There's nobody else. I'm not handing you off to anybody else. It is literally me doing it. So my goal obviously is to keep you safe and give you effective results. So we always are going to balance safety first, and then we're going to do the, we're going to get the effective results. Now, the problem is once you've gone and you've had something done, you've had, whatever it may be, you had a burn from a laser, you can't always perfectly reverse that, like, especially if it was a bad context. We've seen all of our friends on here. We've seen people, some of our Black friends, Hispanic friends that go to the med spa and they got deep skin, and then they get IPL done on them, and it completely burns their skin like crazy because the treatment should have never been done on them in the first place. And now they're depigmented. So a lot of the times with general skin care, putting some steroids in the skin, stuff like that, maybe you avoid some of that stuff, but it's possible for that to persist. So that's really, really hard. So make sure you're going to the right person. I would say if you have a bad event like that and you get burned, then you need to definitely follow up with the person who did it. But the unfortunate reality, yeah, you can email me, Sharky. Email me, and I'll be happy to try it. So the what I was gonna say is go to the person who did the treatment, right? So go to the person who did the treatment, and then they should be willing to help you. Now, I've had patients that come to me that had a problem. They followed up with a person who did their treatment. They literally blocked them. They shut them down. They blocked them on Facebook. They blocked them on TikTok, whatever it may be. Like, which is crazy to me. Like, it's not uncommon for me to see other people's complications. But I think you need to first, you need to give those people a shot. Now, I realize sometimes not everybody wants to put a ton of faith in somebody to kind of help a problem when they caused it. But there could be expense factors. If they're blowing you off, that's a major problem. You don't want anybody blowing you off, but they should be there to help you. And then Bay Area girl, thanks for the follow. I appreciate it. So again, if you guys want to, now's the time to follow. I really appreciate you guys. I'm Dr. Dylan Greeney. I'm here to help you get your best skin. I'm a board certified dermatologist. I've been on TikTok. I help over 500,000 people get their best skin on here. So if you got questions, you can always drop them in my comments too. I literally respond to everything. I'm probably the most accessible dermatologist on social media. So I'm here for you guys. I do these lives more than anybody. I answer questions more than anybody. So I'm here for you guys. If you got any questions at all, if you don't get them answered right in the live, all you got to do is tap through my profile and just drop a question on the video and I'll answer it. So psoriasis diet, some people have tried more of a Mediterranean style diet for that. Anti-inflammatory, you definitely want to avoid alcohol, maintain a normal healthy body weight. Any thoughts on isotretinoin for rosacea? I've used it in a handful of patients for sure, and it helps. It's going to be mainly the rosacea that causes bumps, and some of the induration or thickening in the skin is not going to be good really for the redness of rosacea. Under my hair alone, I have a thick crust caused by atopic eczema. So Black Wolf Clan. Yeah, that's really frustrating. You're definitely going to need prescription medication for that. It's not going to be something you'll probably get handled at home. However, on your scalp, if it truly is atopic dermatitis, you could use CLN shampoo. So you could look into something like that just to reduce some of that bacteria on the skin. But a lot of times, topical steroids or medications like Dupixent, those things can kind of help for sure. So I have dark circles and stretch. I can see my blood vessels. So unfortunately, the blood vessels, right, there's nothing you can do on that to help. Sometimes if you have the appropriate skin type, lasers can be done to actually remove some of those blood vessels into skin around the eyes. And that can be a nice option for it too. Why is my skin so itchy? So the most common reason for itchy skin is dry skin. So that's the most common reason that you can get itchy skin. So you got to be hydrating your skin, particularly after showering, but also, after showering and before bedtime. When you moisturize after showering, you're locking in some of that good hydration on your skin. That's a good way to do it. I got really dry heels. What can I use? My favorite treatment overall for dry heels is going to be like moisturizing ingredients with mild exfoliating acids in it. So things that have things like ammonium lactate. So I would look into things like Eucerin Rough and Bumpy. You can get on Amazon, and there's some really good like urea based balms that can be used on the heels. Those are really, really good options. So yeah, eczema around the eyes just depends. Sometimes that's extrinsic stuff from things in your environment and allergies, but a lot of times you can get you can get psoriasis or eczema on the eyelids, and you just got to treat it with good topicals. So Budapest got melanoma, so had melanoma, and have a biopsy on Wednesday. So I don't know if you were going for a sentinel lymph node biopsy, maybe is what you're saying. So dermatologists actually don't do sentinel lymph node biopsies. It's surgeons that do that, just because it's a very deep procedure, right? Everything we do in the office, a lot of times we do local anesthesia and things like that. But what they'll do is sometimes if you have a melanoma that's deep enough to have a high enough risk for a possibility to spread the lymph node. And melanoma is scary because it can spread through the blood or it can spread through the lymph nodes. But what we'll do sometimes is we will basically send you for sentinel lymph node biopsy. And what they do is they'll inject around the melanoma, and they'll look at where, through your lymphatics, where that injection travels to. And then that knows, well, okay, if that's where this normally travels to, then can we go there and check those lymph nodes to see if there's melanoma in those lymph nodes? Now, the reason that's important is because if those do happen to be positive, then that opens options for other treatment for you with things like immunomodulating, things like immune therapy. So these are things that ramp up your immune system to fight off things like cancer. So that's why that's all done. So at this point, it is somewhat prognostic. Thank you so much, Meg, for the heart me. Appreciate it. Somewhat prognostic, letting you know, like what your risk is for the future, but also may open your options for other treatment options. So I sure hope it goes well. That's going to be something that you're going to go to sleep from. Meg says, hi, green guy. Hello. I'm here. How are you, Meg? Thanks for being here. Meg's one of the great moderators. We have Meg here. We got B here. So some of the great moderators. We used to have Zaylee. Zaylee went MIA. She'd been gone for a while. So let's see. Can I use... I don't even know, Berbelis Aquaforum. I'm not really exactly sure what that is. But moisturizing is key for sure. So that the number one thing that's really tied to psoriasis is being overweight and drinking alcohol. That's probably some of the biggest dietary considerations when you look at something like that. So yeah, those are some of the biggest things that I would look at on that front. So you guys are asking some really great questions today. Appreciate you guys. Let's see. Pulled up here. All right. So yeah, thoughts on vitiligo. So vitiligo, is an immune disorder where the immune system attacks your melanocytes, right? And those are the things that make the color of your skin. It's tough because it can be very, very unpredictable, right? It can get worse. It sometimes can get better. It's kind of hard to know exactly what's going to happen with it, right? It tends to happen in areas where there's friction, like your knuckles, your elbows, also around orifices, like your eyes, around your mouth, sometimes around your butt. So different things like that. Those are all reasons that can happen. There's a lot of different treatments for it. You can get treatments like topical steroids, which has been something we do a lot. Sometimes if it's bad, maybe take oral steroids in a pulse dose fashion where you take it a little bit to see if you can kind of shut that process down. And now there's a lot of steroid-free options too for it. So those are all options that can be done for it. Let's see here. Then we have, I'm a teenager and my face is covered in pimples. Is that normal? And what can I do to treat it? So I think it's a very, very important thing to consider. A lot of us face acne, like, 80-90% of people face acne. So you're certainly not alone. With acne, if you're a teen with acne, you're not alone. The best stuff you can do over the counter would be do things like, you want to do things like, I would do a benzoyl peroxide cleanser in the morning. So my favorite, like you get CeraVe 4% benzoyl peroxide or Panoxyl 5% benzoyl peroxide. These are good options that you can do to help acne. And then at nighttime, the most important thing you can do is a medication called adapalene. And you can get it from La Roche-Posay or you can get it from Differin. If you guys ever forget any of the stuff we've talked about, and honestly, a lot of your common questions, you can click the links in my descriptions and bio. Thank you, Sharky. I'll check that after we get off here. So the if you check the links in my bio, you can go to my Shopify or my Amazon store, and I literally have things broken down by problem: rough skin, dry skin, acne routine, full glowing skincare routine. I got my routine on there. Like any of that stuff, if you guys are asking these questions and you're just looking for great products, they are at the link in my bio. So you can check those out, okay? So I would definitely check that out and see. So any rid of dermatitis naturally, the best things you can really do for dermatitis naturally would be take things like just, get off anything that's irritating, get off that stuff first. Get off the irritating things, and moisturize your skin really well. So things that have fragrance in it, unnecessary stuff like that, get all that out of your routine, and make sure you're moisturizing your skin with something like CeraVe or maybe the La Roche-Posay triple repair moisturizer, because again, your skin barrier is going to be compromised if it's dry, and that's going to make all these things just harder for you to handle. Skin texture like scars. If you're having skin texture and scars from acne or other things, picking, whatever it might be, you can do things like chemical peels, lasers. You could even do home microneedling. And if you're going to do home microneedling, probably your best bet is using things like Banish, or I would do things like Banish, or maybe do things like the Cure microinfusion system. These things are good. Beauty and the Barbell. I love the name, by the way. I love the gym myself too, so that's a really cool name. But I hate to hear that La Roche-Posay gave you trouble. That's awful, And I say this, like, not every skincare product is going to work for every single person. I would definitely say if you're going to start anything new, always make sure to give it a good stretch of time, right? You want to give it time to work. Because if you kind of are jumping around to things really quickly, then in that case, you may not know if something works, or you think something's breaking you out and it was just a random pimple or whatever it may be. It kind of happens. So 13 and 1 in glass skin. Well, you probably got the best skin of your life right now as a 13-year-old. So, it's like you just got to protect it. So great, glowy sunscreen, like the Super Goop Glow Screen is a good option. You don't need to have a too complicated routine at 13. You just got to protect your skin. You know what I mean? That's the key. You just want to protect your skin. And you're very welcome, Marley. I'm so happy to help you. So no, thank you. So let's see. So blackheads, common problem that people have, right? Blackheads are those open comedones, so oil oxidizes on the surface of the skin. And there's the two things you can get over the counter really for that is going to be salicylic acid. So salicylic acid is one of the best things you can use. You can usually use a 2% salicylic acid cleanser, or a 2% salicylic acid toner. That's going to kind of melt into those pores. That's going to melt into the pores and kind of help to break open those pores and allow that to clear out. You can possibly do, pore spatula thing if you're very gentle. Good cleansing with your fingertips. You don't need to do anything that's real aggressive. You don't want to scrub too much or anything like that. Those are things that can help, just cleansing with your fingertips. Good foaming facial cleanser, I would say, overall. Darian asked about fungal acne. So fungal acne, if you guys don't know what that is, it's acne that tends to be, it looks what we call monomorphic. So it's like all the bumps almost look the same. And it's pretty rare, but basically all the bumps look the same. And it's basically like usually on the upper forehead. Sometimes if you have a little bit of a scaly scalp, you can actually get fungal acne on the chest and back too. It is kind of itchy, so fungal acne tends to be a little bit itchy, which is kind of weird for it. So options for helping fungal acne would be things like, there's a great soap called SwoleMD soap that you can get, or you could use Nizoral shampoo as a face wash. These are good options for it. Eye wrinkles, one of my favorite eye serums that are out there, it's actually a balm, is the Versed Smooth Landing Retinoid Eye Balm. And if you get it from Versed, I want to say there's a code, I think it's SWOLE10 or something like that saves you 10%. Wrestler was trying to avoid ringworm, I think. Yep. So Griffin, that ScrubMD soap that I talked about, ScrubMD soap, that was actually made by a college wrestler. So you definitely want to look into that. ScrubMD soap is not expensive. CeraVe is one of the best treatments. If you look back 2 videos ago, 3 videos, I just did a whole video on that of CeraVe and all the great cleansers. So I love CeraVe. It's a great brand. Dermatologist was very involved in forming CeraVe. So eye cream options for dark circles. In that case, I would go like niacinamide. I don't know if you can find ones with kojic acid, retinol, right? Lee, I love that you're asking the question to the audience too, because there's a lot of people out here that have, that have experienced some of these things. So let's see. I'm just looking here. Apparently there's an option to tag some stuff on here. I've never used it, but yeah, I'm gonna see if Versed is on here. Add that on here if it is. I don't know if it's legit though. So I think it's legit. So someone was asking about eye balm. So I can like tag that apparently. Maybe you guys could give me some feedback actually on YouTube and let me know if this like comes through. So trying to get like I'm gonna tag a couple of these things here. So I'm going to tag on YouTube. I'm actually going to tag one of my favorite vitamin C's, and I'm going to tag that eye balm if you guys want. I'll put the eye balm on there. I'm going to go ahead and tag like some of my favorite cleansers as well. And actually one of the cleansers right now, it looks like it's $5 off from Ulta. So yeah, and then I'm going to put in also my favorite so if you guys are here, if you guys want to pop over to YouTube, I'm tagging some of my favorite products if you guys want. I've never done this, so I'd like to hear feedback from you guys. So SPF 40 from Sephora. This is okay. So I'm going to start by tagging like my favorite eye balm. I'm going to tag my favorite vitamin C. I'm going to tag my favorite cleanser and my favorite sunscreen. So basically what we've got a vitamin C, a sunscreen. The only other thing I'll tag in here, this is basically going to be a whole skincare routine then. Yeah, perfect. So perfect. So, okay. So we'll tag all these. So this is going to be like really a perfect skincare routine. But what I'd like is you guys to let me know if you guys see those okay. And let me know, because this is like the first time I've ever done this actually. So yeah. So what I'll say is like this. Okay, we'll just start. I'm gonna just put this. I guess I'll tag the sunscreen. There we go. Try that out and see what happens. So that sunscreen, Super Dupe Glow Screen, is one I love to the end of the world, into the earth right there. So I love that sunscreen so much. It's a tinted sunscreen. It's SPF 40, so it's amazing protection. And it's a nice tint, so you're not gonna have any white cast, and it has a little bit of a glowiness to it. So a lot of people worry when they put the sunscreen on that they're gonna lose that radiance and that glow, but in this case you're gonna keep it, and in fact it might even look better, when you do that. Permethrin cream, does it destroy your skin? It does not destroy your skin. Obviously it's not something you want to be using every day, but permethrin overall does help treat scabies. You can also do treatments orally. So for about a year under the nose, my shin and edges of the lips, super scaly and dry. Kind of almost sounds like seborrheic dermatitis. I don't know. It's always good to see a dermatologist in person. So Tara, you don't see any on there. Maybe it only works when it's on like horizontal live. But Tara, I definitely appreciate you like checking that out. I'll definitely have to look at it after the fact, because I think it should have popped up in the chat, I would think. But I don't really see it either. So I don't know. Maybe it'll show up after the stream's up or done or something. I don't really know. Don't really know. So yeah, anyway. So we got deep under the skin acne. So Kaylee, when you have deep under the skin acne, there's little you can do outside of prescription treatments like oral antibiotics, spironolactone, adapalene. These kind of things can help. Best moisturizer for combo acne prone skin. I honestly just lean into CeraVe moisturizing lotion. It's oil free, it's non-comedogenic, it shouldn't block pores, so that's why I like it. What's the best way to hydrate skin? Water or coconut water, milk. So I would, rather than leaning into like food products, I would use well-formulated moisturizers like CeraVe moisturizing lotion. 29 and I look 40, what to do. So Hashem, one of the best ways to kind of improve the appearance of aging is reduce some of the wrinkling to smooth the skin and help to even the pigmentation. So things like erbium lasers, potentially doing some Botox. These are pretty easy ways to kind of help improve the radiance of your skin, make your skin look a little bit better. So I kind of look at things like that. So yeah. For rosacea, do we really need to have laser treatment, or is there any other ways to get rid of it? So Tara, there's really not, unfortunately. When you look at rosacea, there's a lot of different types. But if you're looking at the redness of rosacea, really the best treatment probably is going to be laser. Now there are some prescription medicines that you can get from compounding pharmacies that are fairly inexpensive that you can apply to the skin, and it will temporarily make that redness go down. So there is that you can do. The bumps of rosacea are quite easily to treat with topical prescription creams. So those are things that can help if you have the bumps of rosacea more than the redness. So how to make the pores go away? Unfortunately, they can't go away completely. I do want to kind of do some quick question and answer real quick here on YouTube. So I'm going to go through some of these on YouTube here. And we will, let me go over these questions real quick. So let's see. Is there topical options for hormonal acne? There are things, TW, that you can do like Winlevi. There's also compounded topical spironolactone. So these are some of the things that can be used for that. So yeah, those are some of the things that can be used for that for sure. So, you're very welcome, Turkey Man. No problem. So let me kind of go through these because I missed some of these. Is using sulfa in the bath good for you? Tom, hard saying, sulfa, that's not something commonly. Some people use sulfur-based soaps. Maybe if you are getting a little folliculitis or you're getting rosacea, actually can help. Albert says, what's the best cleanser for oily skin? Foaming facial cleansers. I like the CeraVe foaming facial cleanser. Tara's only using Chanel products. They're super expensive. Do you recommend them? I actually have never used a Chanel product in my life, so I don't really know. I don't really particularly like skincare products that are super expensive. I think nowadays you can get really great products that are affordable. I don't think you got to spend a ton of money, Tara. So the skin on my lower eyelids is always super dry. Looks like flakes. Shannon, it sounds like it possibly could be psoriasis. I've definitely seen a dermatologist, and you can get, topical steroids or steroid-free agents that can help with that. Depending on how bad it is, you might be able to do other treatments like that. So I'm starting to develop moles on my face. What can I do to remove them? You're in South Africa, so it's tough. A lot of moles either have to be cut out and biopsied. Sometimes they can be removed with a laser. Best cleanser for combo acne prone skin. How to make my skin look white? I don't think anybody needs to be changing the color of their skin personally. So if you're looking for ways to help with hyperpigmentation, you're having dark spots on the skin from sun damage or melasma, one of the best products you can get over the counter right now is one called Remedy for Dark Spots. So Remedy for Dark Spots, I would look into that. Tara, I have no idea where to see the tag sunscreen. Don't see the tag products. Does anybody else see the tag products by chance? We talked about the deep under acne, how to keep the pores tight. So There's another product too called Remedy for Pore Size, but in the end of the day, you want to use that good adapalene. You want to use a salicylic acid cleanser. That's a good way to do it. I'm trying to just catch up on these just a little bit. Bulging vein on the face through laser treatments, no help. You might need a different kind of laser. It just depends if they're treating it with something like BBL. You might be better with using like a YAG laser or something of that nature. What have you seen to be effective for keratosis pilaris? There's nothing that's perfect, but things like amlactin lotion, that can help. What do you mean if I have little red bumps appearing in my arms? It just depends. There's a lot of things that cause red bumps, like what Turkey Man was talking about. That it could be something as simple as KP, but it also could be like a rash of some sort. So I don't know. Merci beaucoup from Quebec. I want to have a dermatologist like you. Well, I'm here for you online, as you guys know. So feel free to drop in the chat anytime, Tara, and I'd be happy to help you. But there's a lot of great dermatologists. I don't know what. So you said Quebec and Canada. So I guess you're kind of far from some of the dermatologists I know, but I was going to make some. They smell awesome, but talk about like $500 or more each product. Yeah, that's crazy. That's so expensive. I reviewed this sunscreen yesterday. It was my most recent video. I reviewed this sunscreen. It's the Sunlia from Sisley, Paris. $355. So I was doing like a sunscreen review thing. And yeah, I did a review. I rated it like 2.97 just because of the value factor. It's so expensive. Like I would never want anybody to pay that kind of money for it, So I think that's crazy. So yeah, so Danielle can see a tagged product. Danielle, are you on the computer or are you on your phone or are you... That's interesting. So apparently you can see them. It just, I don't know exactly where they're at, Yeah, I don't know exactly where they're at. I don't know if it rotates. I'll switch the pen. I'm going to switch the pen to my like favorite vitamin C serum. I'll throw that in there for you guys. So that's my favorite vitamin C serum as well. So you got that. So yeah, I don't know. It is first time doing it. I don't know. So Danielle's on her phone and she can see it. So I figured it's in there somewhere, guys. I don't know where exactly. Where does it show up on your phone? Okay, that's a great question. So Tara, I did comment on the smell of this. So as you know, dermatologists, we're not super big fans of fragrance in general, but it smells like I don't know if you guys have Equinox Gym in Canada, but they get those the cold towels that have like menthol, almost like it's like a menthol eucalyptus type smell. And that's, I don't, maybe that's it. Maybe it's because you're in Canada, but there's a menthol type eucalyptus smell, which if you look in the video, I apply it and my face is like red after. So it's really kind of like a cold burn. It's almost like you put like icy hot on your skin kind of thing. So it smells kind of good. Shannon sees the tag products in the top right corner. So top right corner shows up as course. You can click it, the link and buy it. Okay, cool. So as the first time trying it, I'm just trying something new. So is Accutane microdosing effective? It is, Dylan. It's just a pain. As a guy, I assume I'm a Dylan too, right? I assume you're a guy. There's Dylan ladies out there too, but it can be helpful. It's really hard to do it as a woman because you got to come back for, you got to come back every single night. Mia, it's good to see you in the chat. Mia, thanks for being here, Mia. So good to see you here. So it does help, and it can help you stay clear over the long term. I don't have many patients I do it on. So no, it's not that great. I mean, I rated it 2.97 out of 10. So it just, the problem is it kind of does what it says it's going to do, but it's so damn expensive, which I'm just not about. I think it's kind of crazy. So that's a little bit much. So medicine for hyperpigmentation around the neck area, the diabetes is very controlled. That's wonderful, Susan. I'm so happy it's good and controlled. To help to lighten that pigment around the neck, what I would do is I would probably use a combination of things. The main thing I would use that's going to be affordable and effective for you is I would use amlactin lotion, but I would also consider adding in, there's a product called Faded from a company called Topicals, and that can be used there too. So I would rotate the amlactin lotion and the Faded and do that night, like in the night before you go to bed. Thank you for, whoa, the Jolie, dude. The Jolie, what was that? Jolie the Jelly Bean, or is that Joy Bean? Thank you so much. That thing's awesome. That was epic. That was super cool. So thank you for that so much. Appreciate that. So the tiny diny, thank you, thank you. Thank you guys. Sabrina for the tiny diny. Appreciate you guys. So dry patches on the scalp. For that, you got to kind of figure out, exactly what you're gonna what's causing it. Could be psoriasis, could be seborrheic dermatitis. You know, I'd probably see a dermatologist, get it figured out. For the person asking about the dark circles, on the top right part of your screen, there will be a pinned product called Smooth Landing Advanced Retinoid Eye Balm. It's from a company called Versed, which is really nice. All their products are less than $20. So that's what I would recommend. It's very good. So I really, really like that. Yeah, Tara, let me know if you see it on the iPad or the computer. I want to do more lives. I kind of told you guys that I was going to do more lives on the weekend mornings. We did gaming live. We did gaming lives on like either Friday or Saturday night. And then this morning, I wanted to get on and just directly answer your guys' questions. So it's been a very successful live. It's been really, really nice. Comedonal acne, what I'd say is we've gone over this a few times, Pravin. What I would do is I would actually go to the links in my bio. You can go to my Shopmy or my Amazon store, and that's a great place to do that. This actually is recorded, David, and it will be uploaded to my channel. So if you ever go to my YouTube channel, I would make sure to subscribe, and it will be uploaded in full on the YouTube channel under full live stream Q&A shorts. So it's a cell phone problem, and it might just be, Tara, that you need to update your YouTube app on your phone. It might just be that. So that could be it. So why don't we go over a great full skincare routine? Let's do that. We're going to go over a great full skincare routine in a second. Let's do that. So let's see here. So do you know the reason I get so many pimples on my nose? So the pimples on the nose, common spot for acne, right? You can get a lot of acne there. This is very oily. Sometimes the T-zone is a little bit more trouble than everything else. You can also get acne there. You can get acne there, or you can get rosacea there. Rock is a great line of products, Leah. They make awesome retinol. They also make a great cleanser. And Egan Matho, thank you for all the fest bursts and the love yous. I appreciate it. Nodular acne, cystic acne, you're definitely going to probably go talk about Accutane. So let's talk about that full skincare routine, guys. Just want to say again, for those of you guys, I'm Dr. Dylan Greeney. I'm a board certified dermatologist. I'm here to help you get your best skin. If you've enjoyed this live, thank you for tapping the screen. It really helps fuel the live. Let TikTok know that we're helping everybody get their best skin, and let YouTube know that we're helping everybody get their best skin. So if you guys don't subscribe or follow, then please do that. I want to thank you guys on YouTube for the people that have dropped stickers or super chats. The stickers and super chats are huge, so thank you. That also kind of shows TikTok that like our community is engaged with what we're doing. So I really appreciate you guys doing that as well. So let's run through the skincare routine. So if you guys are going to do a great skincare routine, what I'd recommend is I would do, thank you, Tara, for subscribing. I would do in the morning, I would cleanse your skin. I would use one of two cleansers. I would use CeraVe cream to foam cleanser, or Rock gel to foam cleanser. Either of these are really, really good. I already said it, but I gave you another option. I said it, Michelle, but I said another option. So, and then after that, you cleanse, right? You're going to use vitamin C serum. So vitamin C serum, I would use Brandify. I love La Roche-Posay. I love it. I love it. I've seen it from the ground up. I love it so much. But Brandify vitamin C. If you guys are going to use it, you can use my code Greeney40 on the Brandify website to save 40%. So Brandify vitamin C. Then you want to do a sunscreen to give you a couple great options. To do a couple great options, I would do either the Super Dupe Glow Screen, Elta MD UV Clear Tinted, or Peter Thomas Roth Water Drench Tinted Moisturizer. That's your morning routine. It's perfect. Okay. Now at nighttime, you're going to want to cleanse again. You can use the same cleansers you used before. And then you want to use a retinol or a retinoid. If you're very sensitive and you don't have acne, a Kyler, you use sunscreen because 80% of your skin aging is from the sun exposure. Okay. And we want to prevent skin cancer. So at nighttime, you want to, if you're very sensitive, then use rock retinol. So rock retinol would be a good option that you could use. Rock retinol. Or if you are a little acne prone or you want to be more serious about anti-aging, then use La Roche-Posay Effaclar Gel. Now, for all of those products, I have them linked in my bio. So if you lose them, or you don't get it down or whatever, one, this is recorded on my YouTube channel. Two, it's all linked in my bio for a great skincare routine. So that is going to be the best. Thank you so much. I'm glad you guys like the pants. Appreciate it. First time I've worn them on stream. So I'm feeling them. They're very comfy. So those are, that's your good skincare routine. You guys are amazing. Again, if I didn't get your questions answered right now, all you have to do, I want you, like, if I didn't answer it, then just click over to my profile and drop the comment on my most recent video and I'll answer it. I literally am the most accessible dermatologist on social media. I'm here to help you get your best skin. So now's the time to follow if you don't follow, or subscribe. It's been a wonderful, over an hour with you guys. I appreciate you guys. And I'm on most weekends, guys. So I'm on most weekends. I'll pop on in the morning. You guys can ask your questions and I'll answer them. So make sure to follow right now. Tap it, tap the subscribe, tap the follow. I appreciate you guys. I'm going to shut these down for a while. I'm going to go have some breakfast. I got on here. I'm just coffee only for you guys, but I'm going to go have some breakfast, hang out with my little baby boy. He's only 5 months old. And I hope you guys have a wonderful day. This has been one of the best lives we've ever had. I appreciate you guys. So thank you so much. I'm going to shut it down. Thank you. Thank you. You guys have a good one. All right.